Sudan's conflict is pushing civilians into deeper suffering after more than 2 years of civil war. Now, a cholera epidemic has spread across all 18 states, and health workers are overwhelmed. The International Committee of the Red Cross is warning that unless violence against civilians stops, the humanitarian situation will spiral further out of control. With us now is Patrick Youssef from the ICRC to discuss the crisis. Welcome, Mr. Youssef. So a few days ago, the UN launched a cholera vaccination campaign. So what's the latest on the outbreak?
Well, as you've said, Sudan is sadly now facing its worst cholera outbreak in years. According to the Ministry of Health, more than 2,500 people have died and over 100,000 suspected cases are reported. And that's mainly due to the collapse of social services and the infrastructure. You know, without clean water from clean sources, without hospitals or clinics, containing the spread becomes very, very problematic. We're trying to help. The ICRC, but also the Sudanese Red Crescent are supporting efforts in Khartoum, Sennar, Gedaref, North and East Darfur, enabling the treatment of around 18,000 patients.
So what's left of the health facilities across the country?
Well, you know, between 70 and 80% of health centers, according to the World Health Organization, have ceased to function. This is due, again, to violence, the repeated attacks against the medical mission, against medical personnel and facilities, and the disregard of the laws of war. 80% is more than just a statistic. As you can imagine, it means that mothers give birth without assistance, children do not receive the vital vaccination, and people with life-threatening illnesses do not receive treatment. So it's extremely worrying.
So let's talk about the specific case, Fasher. Tell us about the situation in Fasher. The city in the western region has been under siege for nearly 18 months now by paramilitaries. It's considered as the worst battleground of Sudan's civil war.
You know, it's a particular situation in Fasher, which is every day deteriorating. It's a serious, critical situation for hundreds of thousands of people that are trapped, including a large number of displaced families from previous armed conflicts, who basically have no access to adequate nutrition nor health services. You know, except for one hospital, and that's Al Saudi Hospital, there are no medical facilities to care for those injured or simply for those who have curable diseases. You know, when the report of the United Nations say that nearly 40% of children under 5 are now acutely malnourished, and when our teams on the ground are unable to help those in need, we consider this situation to be extremely dangerous. And we therefore, as we've done in the previous past, keep calling for those who have a capacity to provide access to humanitarian organizations to do so, but also to respect the laws of war and protect those people from the fighting and the impact of the increasing violence.
Patrick Youssef, thank you very much. Situation getting from bad to worse every day. Patrick Youssef from the ICRC Regional Director for Africa. Thank you very much.